Hi, this is Dr. Weider. Today I wanted to talk about one of the most commonly asked questions from our breast augmentation patients. Understandably, everyone wants to know, when can I get back to my usual activity? We have a lot of patients that are very physically active who like to engage in fitness activities or play sports, running, and so forth. So let me just tell you what I typically tell people. Of course, we do tailor it to the individual and to the activities they do and how their recovery is progressing, but this is kind of the typical scenario for a breast augmentation patient in the days and weeks after their surgery. So for the first few days or so, I would recommend that they just take it easy. That doesn't mean just lying in bed or lying on a couch or sitting on a couch. We want them to get up and around, not to drive initially for the first 4 to 5 days, but it's certainly fine to go out with your spouse or friend. After about day 5, most patients can resume driving. Of course, we don't want them using narcotic pain medication if they're going to be driving. And usually by about anywhere from 5 days to 14 days, they can resume work, depending on the type of work that they do. If you have more of a sedentary type job, then usually 5 days is adequate. If your job requires lifting or heavier work, then 2 weeks and maybe even longer will be needed before you can get back to full activity. In terms of fitness, I usually recommend that patients resume walking with, going on long walks, for instance, within 5 to 10 days if they feel up to it. And usually by about 2 to 3 weeks, they can resume some fitness in the gym. For instance, I think at that point it's fine to use a Stairmaster or an elliptical trainer or a spin bike, however you want to limit the use of your arms. In terms of getting back to running, usually we recommend waiting somewhere between 4 to 6 weeks, and we suggest that patients wear 2 sports bras to minimize the movement of their breasts at that point. In terms of doing any other fitness, leg exercises are certainly fine after about 3 weeks, but using your chest muscles should probably be restricted for at least 6 weeks or so. Of course, as I mentioned, we will individualize this plan for each patient depending upon how they're feeling, what their pain level is, and the specific activities that they're interested in resuming. I hope that's helpful, and we look forward to seeing you soon. Thanks. Bye-bye.